So the last hemolytic disease is going to be a autoimmune hemolytic anemia. So as the name suggests, it is an autoimmune pathology going to cause hemolysis, right, resulting in anemia. So this is an immune mediated extracorpuscular defect. So all the intracorpuscular defects are done now. So there is no pathology in IHA, there is no pathology in the RBC as such. It is just that there is going to be autoantibodies formed against these RBCs, and these autoantibodies are going to come and kill the RBCs, right? So it is an extracorpuscular defect here, but it is immune mediated because autoantibodies are formed. So the autoantibodies are going to be formed. So it is going to be an example of type 2 hypersensitivity because antibodies are formed against fixed antigens on the RBCs, right? So RBC's antigen is fixed. So it is a type 2 hypersensitivity reaction. So IHA is going to be divided into two types, warm type and a cold type, based on the temperature at which the hemolysis is going to take place. So warm IHA, as the name suggests, it is going to take place at 37 degrees Celsius, and the immunoglobulins, which is autoantibodies, is going to be usually of the IgG subclass. While cold IHA is going to be of two subclasses again. It could either be a cold agglutinin disease or a cold hemolysin disease. So agglutination or hemolysis is going to happen. So cold agglutinin disease is going to be associated with IgM, and this both cold are going to be associated at temperature 4 degrees Celsius. So warm at 37 degrees Celsius, cold at 4 degrees Celsius. So in cold agglutinin disease, there is going to be IgM autoantibodies formed against the I antigen of RBC. There is going to be an I antigen on RBC. Against that, there is going to be autoantibodies, which is IgM subclass. But in cold hemolysin disease, there is going to be IgG only again. IgG antibody against P antigen of RBC. And this IgG antibody is going to be called as Donath-Landsteiner antibody. Donath-Landsteiner antibody. So the type of antibody and the temperatures are going to be important. So if we come to the pathogenesis of warm IHA, here the IgG subclass of antibody is directly going to attach to the RBC at 37 degrees Celsius. Okay. So this IgG being an opsonin, it has coated the RBC, right? So when this opsonized RBC is going to pass through the spleen, these splenic macrophages are going to identify the opsonized RBC and they are going to kill them. So initially there will be formation of spirocytes. So the macrophages will eat up parts of the RBCs and it will tend to form a spirocyte. So spirocytes are going to be formed, which will then result in the extravascular hemolysis in the spleen. So warm IHA is an example of extravascular hemolysis in the spleen. So spirocyte, the most common cause of spirocyte is going to be autoimmune hemolytic anemia only. Okay. And in the causes, don't think it is hereditary spherocytosis as the name suggests. Okay. IHA is the most common cause of spirocytes. And in the spherocytes here are actually going to be variable in size and shape, unlike the hereditary spherocytosis wherein it was microspherocytes and uniform sized and shaped spherocytes. In IHA, you are going to have variably sized and shaped spherocytes, right? So the causes of this warm IHA is going to be mainly drugs like alpha-methyl-dopa, quinidin, or penicillin. So these drugs can induce induce autoantibody formation, resulting in extravascular hemolysis. Other than that, it can also be associated with CLL. So in CLL, many times we had seen it is associated with IHA, right? Evans syndrome. So it is associated with CLL here, which is a warm antibody type of IHA, and then it could either be idiopathic also. Okay. So in cold agglutinin disease, if you see, it is IgM antibody forming against the I antigen, right? So it is this IgM antibody which has been formed is going to bind to the I antigen of the RBC at 4 degrees Celsius here. So binding is going to take place at 4 degrees Celsius here, and here the complements will be activated. So there is going to be activation of the complements. So with complement activation, there is going to be formation of C3b. So C3b is now going to come and attach with the RBC. So IgM is bound, then C3b is bound on the RBCs now. So now when the RBCs are going to come to a temperature of 37 degrees Celsius. So at 37 degrees Celsius, the IgM is going to detach, but C3b is still present. So C3b is again an opsonin, right? So C3b is an opsonin. So again, when it is passing through the spleen, it is going to cause extravascular hemolysis in the spleen, right? So both warm IHA and cold agglutinin disease, it is going to be extravascular hemolysis in spleen. So both the things, it is opsonization related thing only. So IgG is also an opsonin, and then here C3b is also an opsonin. Even though IgM is the one which is coating, the coating happens at 4 degrees Celsius, but the complement activation is going to happen at 37 degrees Celsius. So 37 degrees Celsius only the hemolysis will take place, wherein the IgM is actually detaching from the RBC. So here again, the causes is going to be everything is related to be M in this cold agglutinin disease. So IgM. So causes are also going to be infectious mononucleosis, which is an Epstein-Barr virus related disorder. Like, so M is here again. Then mycoplasma infections, again another M. And then Waldenstrom's macroglobulinemia. So it is a plasma cell dyscrasia in which there is going to be excess formation of this immunoglobulin IgM. So here again there is going to be an M. So all M's are there, is going to be there in the cold agglutinin disease. If you can't remember this, you can just remember that this IgM is going to bind to I antigen of RBC at 4 degrees Celsius, and the hemolysis is going to take place at the 37 degree Celsius. So in the first one, warm IHA also, the binding is at 37 degrees Celsius and the hemolysis is also taking place at the 37 degrees Celsius only. Then we'll see about the third disease, which is the cold hemolysin disease or the paroxysmal cold hemoglobinuria. So it is PCH. PNH was paroxysmal nocturnal hemoglobinuria. Here it is PCH, which is paroxysmal cold hemoglobinuria. So here it is the IgG Donathan Landsteiner antibody, which is going to bind to the P antigen of RBC again at 4 degrees Celsius. And here again the complement is going to be activated by this IgG at 37 degrees Celsius. And when this complement system is activated now, it is going to form the MAC complex. Okay. So MAC complex is formed, and this MAC complex is in turn going to damage the RBCs. So they are going to damage the RBCs directly, resulting in intravascular hemolysis. Okay. So the causes for this is going to be viral infections and syphilis infection. Okay. So IgG is going to be there in warm IHA, and that is at 37 degrees Celsius. For cold IHA, cold agglutinin disease, it is the IgM kind of antibody against the I antigen of RBCs, attaching at 4 degrees Celsius and causing complement activation against C3b related opsonization, resulting in extravascular hemolysis at 37 degrees Celsius. But in cold hemolysin, so here it is hemolysis is going to happen. So it is an intravascular hemolysis. Here it is the IgG Donat Landsteiner antibody against the P antigen of RBCs, which is attaching at 4 degrees Celsius, resulting in complement activation at 37 degrees Celsius, forming the MAC complex, which results in the RBC damage, leading to intravascular hemolysis of RBC. So what are the findings which you see in autoimmune hemolytic anemia in general? So if you firstly you'll have to check for any drug intake, that is the most common cause. So drug intake history you'll have to check for, or any other autoimmune conditions like CLL, so secondary causes, or any other infection history you'll have to elicit for. And apart from that, if you see the peripheral smear, you are going to see multiple spherocytes, obviously. And in cold agglutinin disease, there is going to be a specific finding in the peripheral smear, which is agglutination of the RBCs. So this kind of an image wherein this RBCs are all quite agglutinated together, sticking together, right? So this is called as the agglutination of the RBCs. They are not rouleau formation. Rouleau formation is going to be stacked like coin appearance. Regularly at a like a pillar, it is going to stand like this. But agglutinin disease is just agglutination, clumping of the RBCs. This is cold agglutinin disease, IgM related. So direct Coombs antibody test is going to be positive. So direct Coombs test will be positive because it is detecting the antibodies attached to the RBCs only. So DCT will be positive in IHA. So now we had seen about IHA also.